Good day, everyone, and welcome to this session entitled The Power of Nurse Triage to Reduce Health Disparities and Drive Proactive, Impactful Care. My name is Mark Hagland, and I'm Editor-in-Chief of Healthcare Innovation Magazine. Welcome, and it's my pleasure now to welcome Cheryl Dalton Norman, who is President of Conduit Health Partners. Cheryl, so great to be with you today.
Thank you, Mark, for having me. I'm excited to be here.
Absolutely. Well, I will tell you that if ever there were a timely topic, now would be the moment for this topic, right? And we at the magazine have been covering everything around this, so I'm fascinated to find out what you have to say. Why don't before we actually plunge in, just tell us a tiny bit about yourself, your own background, and about Conduit Partners.
Wonderful. Well, again, I'm Cheryl Dalton Norman, and I'm one of the founders of Conduit Health Partners. And I've been a nurse for 40 years. And Conduit Health Partners was really founded to drive access to care for people. One of the things that we saw was that people were struggling to get the health care that they needed. And I know as a healthcare professional, I've been a nurse for 40 years, and I struggle sometimes to get what I need for myself or for my family members. And so just recognizing that we just have a passion for making sure that people are able to get the help they need when they need it.
Wonderful. Well, that's a fabulous mission. I have to tell you. So terrific. So let's plunge in. Let me ask you a couple questions here. First of all, many of us understand that tackling the social determinants of health is a central task to achieving the health system's goals around health equity, patient outcomes, lower costs. What challenges do you see that payers and providers are facing in their ability to accurately capture and act on social determinants right now?
Yeah, I think one of the primary challenges that many health systems and other organizations have is really having the data, the information necessary to understand what those challenges and issues are, because they vary by socioeconomic groups, by where you live, what's available to you. So really deeply understanding what's happening within the communities being served, I think is a challenge. And so that's one of the things that Conduit, we've really focused on. It's wonderful to give that care and treatment and to help drive access for people. But to really make deep and sustainable change, we need to provide data to those that we serve, our clients, to say, look, this is who the people are. We're hearing from women, and we're hearing from them during these hours of the day, and they're calling about their children, or they're calling about their elderly parent, really helping folks understand who it is that we're serving. And I think I think that's a huge challenge for health systems and other healthcare providers right now.
It absolutely is, and I'll just say, it's like the old adage about water everywhere and not a drop to drink. There's data everywhere, but no one knows how to use it, or very few people know how to use it, right?
Yeah.
So how do you see the relationship between the social determinants of health and effective patient triage? Where are the shortfalls happening, and how can stakeholders improve the outlook in that area? To me, that is such a rubber meets the road area, don't you think?
Oh, absolutely. And I think when we look at those social determinants of health, whether they be healthcare access and quality, education access and quality, social, economic, all of those things, I think one of the things that I see that is really pervasive, and the Surgeon General of the United States is talking about this, is loneliness.
Yeah.
And if you look at the social determinants of health, I think there are people who are lonely, who don't understand the access to care that they might have with someone like Conduit. We can take their calls 24/7, 365. And what we have found is that many times, once people learn about us, they're not calling sometimes because they have a physical ailment, but because they're lonely. I can't tell you how many times our nurses have spent a lot of time on the phone just talking with someone who just needs a listening ear. And I think when we get to the root of the problems, when I don't have access, when the social determinants of my personal health keep me from being able to talk to others, to keep me from being able to talk with healthcare professionals, it's hard to move the needle when we can't be conversational with folks, and when folks are going for episodic care to the emergency department, where there is not a long-term care strategy coming out of emergency departments.
Exactly. Also for everyone. So, and Cheryl, I'm so glad you mentioned Dr. Murthy. For those who don't know, Vivek Murthy is the Surgeon General. I actually saw him speak at a national healthcare conference for about 4 years ago now on that topic. He was incredibly eloquent. I mean, he's kind of an amazing person anyway, just to listen to. And the thing that I think relates to what we're talking about, that he talked about at that presentation, what he talked about how we think of loneliness as a social thing, and it is a social issue, but it also leads to health outcomes, right? Because lonely people are less likely to be medication adherent. They're less likely to go in and get care for the things they need. They're more likely to have accidents and falls, everything that you can imagine, right?
Yeah, absolutely. Well, and I think, when I go to a healthcare provider, if I'm really, really sick, I need someone else with me sometimes to hear what the physician is saying,
Exactly. Yeah,
to be my advocate. I can't think of, so many times I've gone with family members and friends just to help make sure that, are we all hearing the same things? Do we
exactly.
understand the things together? And so, yeah, loneliness and having someone who is dependable with us and who can say what they're observing. I might not even observe what's wrong with me.
Yeah, well, exactly. Yeah, and many individuals, especially many elderly, they do have certain deficits. They have cognitive deficits, psychological deficits. Yeah, all terrific points, Cheryl. So tell me, why would you say that a nurse first approach to patient triage is so foundational when it comes to addressing social determinants and population health strategies? I think I can guess, but I'd love to hear you tell us.
Yeah. So I think the nurse first model is so important because sometimes, let's say I'm working, I'm trying to work, I have a lot of children, I live somewhere very rural, I don't have access to a lot of things. When I call and need help, I'm not looking for someone to call me back in an hour or 2 hours. I need the help in the moment that I need it. So when you have a nurse who's able to take that call first, talk with them, really listen to understand what's going on, and in one call, make the determination of, hey, here's what you can do at home. Hey, here's what, yes, you need to go to the ER and let me get 911 called for you, get someone coming for you. Or, let's get you into your doctor in the next 24 hours. You need that right then, because most of us in the United States, we're tied to immediacy. I won't wait for you to call me back 2 hours later. I want you to help me when I need help. And so that's why we believe that nurse first model is so important. And people feel respected when they're heard during the first call, not later.
Absolutely. Oh yeah, I can relate to that. So what does a high functioning nurse triage program look like?
Yeah. So for us, we feel that it's really important to have a strong quality program and to have strong protocols. we don't have nurses who are just going, oh yeah, well, I think this or that. We utilize the Schmidt-Thompson protocols, which are pretty much the gold standard for nurse triage. So it's evidence-based. So we're using a systematic process so that we don't have a lot of variation. Like, you might think that something is no big deal, but I think it's a big deal as a nurse. We have a standardized approach to looking at things so that we're making sure that everyone, no matter who they are, no matter where they're calling from, why, we are approaching them in a consistent manner so that we're ensuring high quality, and we're listening to these calls, we're recording these calls, we're doing quality checks on these calls to make sure that we haven't missed anything, that we haven't inappropriately addressed anything. So having a strong quality element there. But for us, one of the things that we've really focused on too is that sometimes you're like, oh, well, this is a great nurse. They're clinically competent. They have, 15 years of ICU experience. They've seen and done it all. Are they kind? Do they listen to people? Are they compassionate to people when they call on the phone? So you can be clinically expert, but not amazing in talking with people who are sometimes freaked out. They're calling because they have a problem, and and they may not be able to describe it quickly and easily. So is this a patient and kind person? So we really think about clinical quality, but then we're also really thinking about that human element, that compassion, and then making sure that we're tracking what these outcomes are, and we're sharing them with our partners to say, hey, we've noticed that you have all these complaints in your community or in your patient population with abdominal pain. Wonder what that's about. Looking at what is the pattern, to help health systems and organizations and payers really go, maybe we should think about this some more.
Yeah, that's wonderful. So I'm hearing things like service, engagement, and measurement in what you just said.
Yeah. And it's social determinants of health. I mean, if I already feel marginalized and I have experienced being marginalized in my life, I'm just waiting for someone to treat me in an unfair or with lack of compassion. So we have to be really careful that we are especially kind and compassionate and listening.
Yeah, absolutely. Yeah. And unfortunately, many people have had the experience of uncaring interactions. Yeah.
Oh, yeah.
So what can payers and providers expect to achieve in terms of better outcomes and improved cost profiles with a high functioning nurse triage program?
I think one easy measurement in this is really looking at ED utilization. So what is the percentage of people who are continuing to go to the emergency department, but not just going to the emergency department, but going for low acuity illnesses. So I'm spending 2, 3, 4, 5, 6 hours sitting waiting in the ED for an earache, or an abrasion, or a sprain, or something along those lines, and really helping people to, the ED often becomes a default for people who are marginalized because they don't have the ready access to other types of care. And so what we try to do in our work, we work with FQHCs, we work with health systems, physician practices, payers. We try to find the most appropriate level of care. So where can you get the care you need that doesn't already put someone who might not have the financial resources to pay huge hospital bills? What if we got them to the appropriate level of care that was less costly, met their need more quickly, and provided a more longitudinal level of care?
Yeah.
And sometimes we're helping people get established with a practice or a physician.
Yeah, that's terrific. And how does triaging with a nurse first approach lead to better patient satisfaction? I think you've already kind of hinted at some of it, but please expand.
Yeah. Well, I think when you have a registered nurse who's talking with you on that first call, again, like we talked about, the speed to an answer. Also, one of the things that we like to do is that if you decide that if we decide together and you feel comfortable that, maybe I'm just going to take care of this at home, I'm going to take some Tylenol, or I'm going to do something, or I'm going to wait till tomorrow when I can be seen in a physician practice, we're always, call us back. If you want to talk about something else, if you have more questions, call us back. Because a lot of times I might not hear you the first time. When we're stressed, we don't hear things really well. So I might, be like, okay, I've got it, but okay, now I'm not really sure. So call back. We keep all these, we know what we've told you. We can talk about it again. And we just want to be sure that people have all their questions answered and that they feel comfortable with the decision that's being made.
Absolutely. That totally makes sense. So let's talk about all of this from a resource and ROI perspective. How is nurse triage based management in this area a good outsourcing choice?
Yeah. So as you, I'm sure, here nationally, there's a nursing shortage. And having been a nurse for 40 years, I've seen a lot across my career. But right now, the nursing shortage is dramatic. COVID exacerbated it, and it's still not recovered. Health systems are struggling. A lot of folks are struggling. So when you think about what is the best and the highest utilization of nurses who live in the community where a health system is, or practice, or payers, when you think about who do you need to have hands-on, these are the people who live locally in your community. We're really fortunate with Conduit that we hire nationally. And so because we work virtually, our nurses work from their homes. So we have folks who live all across the country. And we have nurses that are licensed in every state. We actually are finishing up our last two right now, which are Alaska and Rhode Island. We probably have them and I just don't know it. But we have nurses that are licensed everywhere because you must be licensed in the state where the person is, not where they live, but where they are in the moment. So it's not, I wouldn't think it'd be normal for most health systems to have nurses that are licensed across the country. So if you are in Florida and you call me in Ohio, I can't triage you unless I'm licensed in Florida. So having a resource that has the appropriate licensures, that has the appropriate data analytics, the ability to have quality checks and balances to make sure that a great service is being delivered, and who is expert in that type of nursing, I think is really important. And let the local folks work in that hands-on environment rather than pulling people away from the bedside to do this work.
Yeah, absolutely. There are so many resource issues involved here. It's kind of mind-blowing. Could you give us just a couple of examples of ways that nurse triage can effectively address SDOH in partnership with hospitals or payers?
Yeah. So, interestingly enough, there have been several situations. We actually serve several homeless shelters in the Wisconsin, in the Madison, Wisconsin area. And one of the things that we have found through our work there, we had a mother who reached out one night. She was living in a shelter and she had 3 small children who all had rashes. And, it's like, I'm already in a shelter with 3 small children with no other resources. So help me figure out what I need to do. Do I need to go to the emergency department? What are my other options? How can I get my children taken care of?
Yep.
And we see a lot of pediatric calls because parents are very, often parents will put their own health aside for that of their children. So being able to address those concerns, I think, is really important. And interestingly, one time we actually had a school age child call and say, can you help me with my school project? I'm not sure what was going on with the parent. The parent could have been working, but they were resourceful enough to say, hey, can you help me? And we did. Because education is a social determinant of health. So we're going to help in whatever way we can to help people get the care they need, whatever that may be.
It's wonderful, especially if the nurse was good at math. That was
right. They didn't
Um,
call me for that, I'll tell you.
right. Well, no, that is terrific, honestly, Cheryl. So let me ask a final question of you. Why is nurse triage an important element in health equity? Everyone's talking about health equity now.
Yeah. Well, I think when you think about health equity and whether I live in an urban area, a rural area, no matter where I am, one of the things that typically is available to most people, even whether you're in a shelter, wherever you are, is most people have access to a phone. And if you can have access to a phone, even for 5 minutes, you will be able to receive help when you call nurse triage, at least from Conduit Health Partners. The first call you make, we will help you. And we are not looking at your finances. We're not looking at where you live. We're not looking at your religion, the color of your skin, or the language you speak. We will be able to help you. And that's really important to us. And we believe that people need that kind of 24/7, 365 access to care. We think it's important.
Well, it's a wonderful mission, and it sounds as though it's being executed beautifully. So huge kudos to you.
Well, thank you. It's important to us.
Yeah, great. And finally, how do you see your landscape over the next few years? What do you think how will it evolve?
Yeah. Well, we are excited. We're growing. We continue to have different types of opportunities to utilize nurse triage, from employers to payers to health systems, physician practices, community lines, shelters. I see a growth in that arena just because most health systems believe it's important for people to have access to care 24/7, 365, and also affordable care where, I wouldn't be afraid. If I show up at the ER, I know I'm going to get a bill. If I call nurse triage, someone's going to help me, and there's not a financial component to it for me. I think there's only going to be growth. And then I'm really excited about further virtual care opportunities. The shelters that we work at in Wisconsin, we actually have a video capability there, so we can see one another. So I'm excited about the growth of more video capability. But I think the phone will always be an important element, particularly for those folks who are more marginalized and need greater opportunities.
Well, all wonderful. And again, congratulations to you for all the work that you and your colleagues are doing, Cheryl.
Well, thank you so much. It's been a pleasure.
Great. Me too. So thank you so much, Cheryl Dalton Norman. And thank you to our friends at Conduit Health Partners. This concludes this session, and have a great day, everyone. Thank you.